Okay. Oh, fantastic. Good morning, everybody. Please come down and find your seats. There's still enough space for everyone. Welcome to Plenary 5, Investing in the Health Workforce to Build Sustainable Health System. You see that this topic is very closely related to the conference theme, Investing for Sustainable Health and Well-being, because we firmly believe that without sustainable health system, there will not be any sustainable health and well-being. And one very important component in the health system is the health workforce. But we all know, unfortunately, this cannot be taken for granted because Europe is facing a health workforce crisis. We have shortages in countries, we have skill gaps, not enough primary care doctors, not enough nurses, not enough long-term carers. We have attrition, we're constantly losing health workers to other sectors, other countries. And we have also medical deserts, even in densely populated countries, places where we cannot provide all services at the right quality. And clearly this has consequences for the patient experience, for the quality, for the safety of care. And of course, many countries have embarked on recruiting and retaining health workers, and this is all important, but it's actually not good enough because the health workforce crisis is not going away anytime soon. It's a very fundamental crisis, and it's linked to the demography. We all know longevity is great, but the aging of the population gives also rise to more chronic disease and multimorbidities and a lot of additional need. But also our health workforce is aging quite quickly, actually, you know? And we will see retirements over the next 10, 15 years, and it will be very difficult to replenish the health workforce in many countries. And again, this is part of the demographic narrative, because the cohorts from which we can recruit new entrants into the professions are also getting smaller, shrinking. Some countries say we already have 15% of the health of the entire workforce working in the health system. We cannot recruit more, actually, you know. So this is why so many countries are actually on a big transition, to new models of care. Primary care, integrated care, population-based care, case management, disease management, all this sometimes in combination, but all this requires a lot of digital and also, I believe, in the future, artificial intelligence. And you may remember Sandra Gallini saying in the first plenary, embrace digital and AI. And I think she's right so, because the way we need to coordinate, to communicate, to steer health systems, patient pathways, information is really about the digitals. But unfortunately, we have digital skill gaps. And this is one of the themes we want to address today, and we want to see what to do about it. And just to frame a little bit the debate, we've been doing research actually a couple of years ago for the 5th Global Forum, Human Resources for Health in WHO. And we were wondering, you know, if you want to invest in the health workforce, if you want to strengthen the health workforce, that it contributes to sustainable health systems, what do you do? And the message was very clear. It's a twofold message. Number one is invest in education and training. So it's not necessarily about the salaries. It's about education and training in the first place. Once you've done this, you need to protect this investment. It's not helpful if you invest in the health workforce, but the working conditions are so bad that you lose your health workers to attrition. So you need to protect it, and this is the second step. You try to protect your investment by investing into the protection, the social protection of health workers, the mental protection of health workers. So there's a lot to do about this. And much of what we discussed today is actually based on a big project, a Be Well project, it's called. It's from Erasmus+. And It's led by Federica Margheri from the European Health Management Association, and we have produced a policy brief on it, to bring together also for policymakers to understand how they can actually address the skill gaps. Where is the skill gap? What is it exactly? And if you're interested in this, you can also read in the EuroHealth special issue, which we did for this conference, some of the information on this plenary. But I would like to start with my colleague Gemma Williams, who is a research fellow in the Observatory and who has actually authored this excellent policy brief. And we've worked very, very closely with the Be Well project. But fill us first of all in, what is it actually, these digital skills? What do we need to understand with it? And what are the gaps, and why do we need to close all these gaps, Gemma, please.
Okay, so I don't want to derail the plenary in the first 2 minutes, but I'm going to, because I think before we get into thinking about what we mean by digital skills, there are perhaps 2 definitions we need to think about first. So the first, what do we actually mean by the health and care workforce? So when we say the health and care workforce, I'm going to lean into a WHO definition. So that's everyone engaged in actions whose primary purpose is to improve health. So while that includes healthcare professionals, your doctors, your nurses, your pharmacists, your dentists, it also includes other staff. So your managers, your hospital administration, medical assistants, lab technicians, etc. And digital skills is not just about upskilling, reskilling your healthcare professionals. It's also about ensuring your wider workforce has the necessary digital skills to use digital health technologies. So can your managers use real-time monitoring and surveillance systems? Can your hospital porters use digital systems to know which patients need to be moved and when? It's also, the digital transformation is going to require sort of new and emerging occupations as well. So we need to be a bit with future thinking as well. So, do we need, we do need cybersecurity experts, for example. We need health bioinformaticians to analyze and interpret large biological and clinical data sets. Are we, as we move forward, are we going to need AI ethicists to guide the responsible and equitable use of algorithms and digital tools? So that's just a bit of context, is we're not here just sitting here talking about up and reskilling doctors and nurses. And I think another definition that might be useful, because we might not all be experts in this area, is what do we actually mean by digital health and digital health technologies? So again, a WHO definition, digital health is just the use of digital technologies to improve health. And the digital technologies we're talking about range from e-health tools, and that's the use of ICT tools such as electronic health records with patient summaries, e-prescriptions, telehealth to improve communication and coordination. It covers mHealth tools, so mobile apps which help to empower patients, provide remote monitoring opportunities. And then we're also moving into big data analytics, AI, robotics, sort of the advanced tools which can help us analyze vast quantities of data to identify trends, improve diagnostics, guide policy decisions. And that again, I just bring that up to say we're not just talking about the digital skills to use electronic health records. We're also fast moving into the area of countries using AI, so we need more advanced skills, and that is changing very rapidly as well. So now I come back to your question. What do we mean by digital skills? So digital skills really are just the practical and technical abilities to use digital tools and technologies. So basically, can you operate a telehealth platform? Can you enter data into an electronic health record? In short, it's what can you do with your digital technologies? However, it's actually maybe more useful to talk about competencies, so digital skills and competencies, because competencies go beyond skills, and they include the knowledge, the skills, and the judgment to use digital technologies safely, effectively, and ethically in healthcare settings. And we have many digital competency frameworks which have been developed. They've been adapted to different professionals, different care areas, so primary care, hospital settings, and covering different regions, different countries, because it's not the sort of one competency framework can cover every professional and every setting. So, and we'll hear, I'm not going to say much more about competencies, because I know Federica is going to pick this up in one moment. So your next question.
So, Gemma, clearly you open up the perspective because it's quite comprehensive. It's not just doctors and nurses, as you say, but it's actually almost everybody involved in the health system, and not necessarily those caregivers alone, but also the other people. How about actually the patient and the families? You know, I mean, a lot of care is given by family members, by parents, do they need these skills as well?
Yeah, of course. And actually, I was involved in a session yesterday which talked about digital inclusion. And there are sort of, digital technologies, they hold great potential to improve health, to empower patients. But there's also the big risk that it will enhance health inequalities because not everybody has the same level of digital literacy and can't use digital health technologies to the same extent. So we need to make sure that patients and the general public have a certain level of digital literacy to be able to use digital health tools. And actually in the session yesterday, we heard country examples of what countries are doing to help improve the general digital literacy in the population, but also specifically amongst patients and carers.
And as I understood from your talk, some of the skills are very specific and probably only a handful of experts need these skills, while others are quite widely and very, very basic actually, isn't it?
Yeah, and I think that's where competencies come into play because you have your basic digital competencies that definitely all healthcare professionals will need and your wider health and care workforce will need as well. But then as you say, there are sort of very specialized tools that would just be only certain healthcare professionals will need them. Not everyone obviously will have to use robotics. The skills a GP will need will not be the same as a radiologist, will not be the same as a dentist, etc.
Actually, Federica and me, 10 days ago, we were in a policy dialogue in a country part of the Joint Action Heroes, and it was discussing on digital skills, and we had people from the federal and from the regional planning commissions there, and they all complained that the basic digital skills in the health workforce are missing. The dealing with Microsoft software, doing proper Google searches, which are sometimes part of the routine actually, and they said that many people above 45 cannot handle this actually. So thank you so much. So we will come back to you in a second round. Actually, my second part of the question is, why is it important to close these gaps? But I think it's now quite clear actually why it is important. You want to say something about why it is important to close these gaps?
Yeah, I mean, I think the digital equity, that's an important aspect. I would say just one thing on this. So essentially digital tools, as well as what they can do for patients and for health systems, they also should help improve the working conditions for healthcare professionals themselves. So I think that's important to sort of look at. They should, in theory, help reduce admin burdens. They should, in theory, help healthcare professionals save time, improve healthcare, make more accurate diagnosis, etc. But that can only be achieved if they actually have the right skills to use their technologies. Otherwise, there's a risk that actually it will increase admin burdens, increase the time spent on tasks. And so therefore, if we invest in skills, we're investing in our people, our healthcare workforce, we're improving recruitment, retention. And also, if you want to be a bit more future-looking, it might help attract young people to work in the sector. If roles are more exciting because of digital technologies, if you can do more, it might help retain people, attract people to the profession, keep them there. And if you're investing in basic training at the undergraduate level, you're in building skills. Even if they don't end up working in the health system, if they go elsewhere, it's still of use to your economy and to your workforce in your country.
It's also a little bit about attitudes, isn't it? Because Federica and me were told that in this particular country, many of the medical records the electronic medical records are almost empty because the attitudes, they don't like to enter a lot of information, or they do it still old style, on hand on paper. You want to say something?
I mean, that's again, if sort of a technology is rolled out without proper training beforehand, it's going to cause lots of problems. People are not going to use it because they think, why am I wasting my time when it's much quicker to do it by hand?
Very good.
So then you don't get the benefits of digital technology. So you need to make sure people are properly trained before these systems are implemented. And ideally, they should be involved in the development of the tools themselves.
Thank you so much. We will come back to you in a second round to hear what countries are actually doing, to address the skill gap. But first of all, we would like to hear from Federica. Federica is the director of EHMA, and she has been the consortium lead of an Erasmus Plus project, Be Well, which was looking into skill gaps, and in particular digital skills, also green skills. And the specific and very important thing about it, it's not only a kind of expert science-driven project, which was, it was expert and science driven, but it was also with the social partners, with those who are in the end in charge of organizing training and retraining and all this kind of stuff. So first of all, Federica, that we get a bit of tangible feeling, you know, what sort of material has Be Well actually developed under your leadership? What sort of training? Sorry, that was the wrong question, Federica.
No, that's fine. I mean, I can answer that.
Well, of course, yes, yes. I know that you can answer.
I can.
But yes, fill us in a little bit on the training material that Be Well has actually developed to address these skill gaps, which you just heard from Gemma.
Yeah. So what the Be Well project has produced is actually a suite of around 25 training courses. These are online training courses, but as Matthias, you have mentioned, in fact, there are 21 that tackle digital skills, whereas the other 4 tackle green skills. I think that more than the final product, which I still think it's quite important because it really enables upskilling and reskilling on the workforce, I think that the methodology that got us to that product is equally important. What we did was to start a social dialogue from the very, very beginning of the project. We wanted to involve every single stakeholder from the get-go. We wanted to get their input. We didn't want these trainings to be, once again, something that someone in a room in Brussels decides and then plug into any given context. So based on the skills intelligence that our partners developed, based on, in fact, what Gemma was mentioning, the skills mismatches, based on a lot of consultation with doctors, nurses, health employers, professional organizations, educators, then this is how we got to develop competency matrices that cover topics such as data literacy, cybersecurity, telehealth, robotics, AI. And these competence matrices, then they were again, put under consultation, agreed, approved, and it's on that basis that then we developed the suite of courses that are now available online. And the other thing about these courses that I think is quite important is that these are short, massive online open courses. They present blended learning. So there is, of course, we can call it the frontal teaching, of course, online, but there are also exercises, case studies, and they can be used either as they are, so people can take them, but they can also just be used as an inspiration to be modified according to a specific setting or a specific context. They are also translated in multiple languages, so again, we can see that we also looked at the diversity to avoid the language barriers across different countries. And I think that, yeah, that covers a little bit what we have produced as Be Well in terms of training materials.
Thank you so much, Federica. And I mean, it's really great because you really defined the skills and competencies needed in great detail, you know, based on the evidence, yeah, but also supported by the consensus of the social partners. And then you kind of converted this into training material, online training material, and you make it available in many, many languages, actually.
Yeah, indeed. And again, I think that the collaboration with the social partners was not just a need, but was crucial for success. I don't think that any technology, especially new technology, cannot just be plugged into a context. It was really about co-creation. Gemma mentioned these. There was really the need to understand what was necessary from professionals. I mean, we can get into these. Agreed. One of the things that we learned from the piloting is one of the most taken courses is, in fact, the Microsoft and the Google suite. So clearly, I mean, there are some more advanced courses, but there is a need for the basics still. So we cannot take that for granted, and we need to listen to what is, in fact, necessary for the health and care workers.
Very good. Thank you so much. Henrique, great pleasure that you could make it that you are with us. You're not only a professor for epidemiology, but also the president of ASPHER, of the Association of Schools of Public Health, and this gives us, you know, two opportunities. First of all, talking about, you know, what does the public health workforce need in terms of digital skills? Because so far we were talking about the healthcare workers, and well, it comes somehow easy, you know, when you think about electronic patient records and all e-health, m-health and whatsoever. But what is the public health workers actually? What do they need, you know? Please.
Thank you very much. Well, let's think about digital public health and remember that it blends technology, health sciences, and social sciences. So it might be interesting, even boring, to list the skills we are talking about. Some have to do with literacy, digital literacy, data literacy, AI or machine learning literacy. Others are kind of a change of things that we are using nicely in the past, but now we have digital epidemiology and surveillance. We have the need for digital health communication, and we need to know about cybersecurity and special aspects of data protection. But others are even more complex, but I would say desperately needed, like digital ethics and governance, digital infrastructures, health information systems in a digital world, digital health promotion, behavior insights, digital project management, and even digital leadership. So in general, I think we can say that the skills we need them to guarantee the digital public health in action, meaning the use of these technologies, data, and many innovative tools to achieve public health goals. That those remain, preventing disease, promoting health, and making communities and protecting communities more effectively and more equitably. But in other words, we can say that we need them to integrate digital health and public health principles, and obviously our essential operations. So a trained workforce with strong digital skills, and I think public health workforce needs strong digital skills nowadays, is essential to improve and reach health interventions, to support early detection, respond to health threats, new pandemics, for instance. But also, we have the obligation to use them to empower citizens through access to information and self-management tools, but also, as you said, to have a dialogue with policymakers so that they can design well data-driven, hopefully equitable health policies.
Henrique, you were just mentioning the pandemic, and I was wondering whether there were lessons to be drawn from the pandemic for digital skills, also knowing that we are actually, as Hans Kluge said in the opening plenary, you know, it's not from crisis to crisis, but we are navigating a perma-crisis actually. So were we well prepared for COVID-19 and digital skills, and have we drawn the right conclusions from it?
Well, we are not, but we moved quickly in terms of technology, maybe not that much in terms of accepting things. For instance, if you think about the way we handle contact tracing apps and the many problems, again, ethical, data protection, all those type of things that they raised in a society that is putting more or less everything in the public domain. I think we need to reimagine a way of discussing and sharing the risks and the advantages of these technologies. But this brings, I think, an important aspect, because it has to do with how the workforce, so let's say, what the public health professionals need to know, how they are going to work, and what tools they are going to use. And there's a lot to invent, I think, still.
Henrique, can I ask you, you heard what Federica was saying, and I mean, of course, the skill frameworks, the matrices, and the training material is meant to be for healthcare workers. But do you think there's also something in it, you know, you could learn or you could adapt for public health workers?
Yeah, but there is a lot of things that can be adapted. There are specific aspects. One of them is because I think it has to do also with the history and tradition of the hygiene tradition even. It's how to guarantee trust. Can people believe in what we are proposing them and what we are trying to share with them? And I think we have a lot of things to do in this direction.
Thank you so much, Henrique. Marius, you heard all this, and you are actually, amongst many other things, the president of the UFA section on human resources for health and leading the research and showcasing here what is currently going on. How can actually research contribute the development of digital skills in Europe? Please, Marius.
Thank you so much, Matthias. First, as I was sitting here and listening to my colleagues, I realized something, and I don't know what this says about us or about you as moderator, but we're discussing about digital skills, and all your panelists have pen and paper written notes, and we don't have iPads or Remarkables. But before answering to your question, let me start with a quick story. In one of my other roles, I'm advising a team of technical people developing some sort of AI-powered tool to help with navigating the cancer care journey for patients. And just at the beginning of this week, prior to coming to Helsinki, I was in a big academic hospital in my home city of Cluj-Napoca in Romania. And we were discussing with clinicians, specifically doctors, about that solution. And as I was leaving the meeting, I was reflecting about what I've seen in that room. And of course, I'm a researcher, so I'm not generalizing. I am very careful about that. It was a single observation. But it got me thinking about the skills that we are needing in the health system in order to deploy digital health technologies and AI tools. And there were three things that I've taken from that meeting, and they were not mainly related to digital skills. One of them was related to autonomy. I was listening to those doctors, and I could read between the lines that their sense of autonomy was every time in check when they were hearing about that solution. I was hearing about various degrees of aversion to change, not necessarily maybe from those in the room because they were early adopters, but maybe from other doctors or other health professional categories. And then I was also hearing a lot, and I was really happy to hear about that, about the collaboration between health professionals on the one hand and patients and their families on the other hand, something that you mentioned. But now coming back to your question with regards to what research can do to contribute to providing some answers, and particularly what our health and care workforce section here at EUFA can do or is doing. And I will quickly mention a couple of things about that. So first of all, I believe we must be clear what we're trying to achieve. And Gemma and Federica and Henrique also mentioned that the fact that digital health tools and AI are a means to an end. And the end, in our case, is that we are able, with our health systems, to provide care to the people in the, who are benefiting from the health system, care that is safe, that is equitable, and that is of high quality. Second, we must ask the big questions, but maybe we should also take a step back and ask the small questions beforehand, and I was happy that Gemma started with that. What is the health and care workforce? What are those categories? What are the AI and digital health tools? And maybe I'll come back to that further in this conversation. And for what tasks? And then this is really important because we have lots of categories in the health system that are absent from the digital skills conversation. Third, in order to quantify the digital skills gap, we need to look particularly where it is invisible, particularly with regards to skills required to use digital tools in a responsible manner, the skills that are needed to govern the AI outputs, and also the competencies required and also linked to the BOL project to protect data quality, ethics, and equity. Fourth, we need to embed the digital skills into health workforce planning. We have been discussing that digital health and AI will transform how we deliver care, how we train professionals, and we need to take that into account when we're doing the planning. And fifth, it is really important to have collaboration. We have on this panel, we have Observatory, we have EHMA, we have ASPHER, we have EUFA, we have the European Commission, and I believe that is the spirit in which we need to go. And most important of everything, I believe we need to have a value-driven conversation. This conversation should not be driven by a profit or by various interests, but it should be driven by values like transparency, fairness, accountability, and alignment with public health goals, as Henrique was highlighting. Our Health and Care Workforce section have produced a paper, I believe it was just last year, in the International Journal of Health Planning and Management, where the main message was that we need to balance the goals that we're trying to achieve with the health workforce with the need for digital health innovation. And before I give you the word back, I have to mention that our section is organizing on 23rd and 24th April in Cluj-Napoca its midterm conference, and already we have been discussing the discussion around digital health and AI will be core to the conversations that we'll be having in April in Cluj-Napoca.
Thank you so much, Marius. And clearly there's a big agenda actually which needs to be picked up, and from the small question of digital skills it grows bigger and bigger, and actually you can see that it's also linked to the success of new models of care, you know. Without these digital skills, you know, we will have very great difficulties to have very effective primary health care, care integration, and so on. And I see you already nodding, Petronille, and we've asked you to join us because we know that the European Union, the European Commission, is providing lots and lots and lots of different support tools for health system development, you know, and digital, artificial intelligence are really very big amongst them, and we would like you to fill us a little bit in, also maybe with a view to think, you know, where can we actually be part of it, you know, where can we participate and use these funds and structures and activities. Petronille, please.
Thank you, Matthias. So actually, I will start the way you started, because health professionals, they're really the backbone of our healthcare systems. So we need to treasure them. They're sustaining our societies and playing a key role as trusted figures as well. And as you mentioned earlier, we have a shortage. I'd like to put a number on it, which was published in our 2024 Health at a Glance report, saying we have an alarming shortage of 1.2 million doctors, nurses, and midwives across the EU, as estimated in 2022. So we're doing lots of activities to try to address these shortages. We're focusing them on 4 key areas, and actually all areas have already been discussed today. The first is planning. Matthias already mentioned the Joint Action Heroes, funded under the Year for Health program, is making important contributions to improve data, models of care, and as Marius mentioned, it's really important to also plan your skilled professionals accordingly to the needs and to how the future will evolve. So our Joint Action is very much working on that. Then second, recruitment and retainment. And fourth, training. So training, this is a general ambition of the European Commission to strengthen skills. We recently renewed an initiative which is called the Union of Skills. So this is an initiative which highlights the needs to upskill and reskill the workforce in various sectors, including the health sector. Regarding training, more specifically digital skills, as we're discussing today, we're approaching this through several fronts because, as was mentioned earlier, we need to both train our workforce in training, so students, but we also need to train those that are already working in the field, as this is a rapidly evolving field. So we are adapting curricula of the health workforce training, and we're supporting continuous professional development. And the other thing which comes with this digital transformation happening at a high pace is that we don't only need to strengthen skills for today, but we need to strengthen skills for tomorrow, for the future as well. And so as mentioned, this is not only supporting basic digital skills going to advanced digital skills, but also looking at transferable skills. So how can we prepare a workforce for change management, how things will change tomorrow, how they will need to already adapt their communication skills, because we don't always know exactly where the future is bringing us. AI tools are developing very quickly, and we don't know how much in detail this will change our everyday work. So how are we doing this? As mentioned before, the European Commission is funding through Erasmus Plus the Be Well initiative, one of our centerpiece actions. And what we're looking forward to is the skills strategy. So Be Well is developing a strategy looking at how we can prepare the workforce on digital and the green transition. And also they're developing innovative training curricula and bring together all different types of digital trainings on their platforms. What else? Through the Youth for Health program, we have 7 training projects, and I'm actually glad we mentioned these basic skills to much more advanced skills. And also we need to make sure that we train in all sectors, in all specific areas of the healthcare system. So we have these 7 training projects that go from AMR training and specific trainings related to cybersecurity in that area or relevant fields there, to all the way to cancer. And also there, for these 7 training programs, we indeed focused on making sure that we don't only support our clinical staff, but also the non-clinical staff. As mentioned earlier, it's really important also to have your managers on board, data managers, healthcare managers, I mean, of course. So we're also definitely working on that. So through these 7 projects, we're reaching around 18,000 health professionals across the EU. We're also not forgetting nursing. We have a nursing action funded by the EU, which is led by WHO. And through that, we are working on recruitment and retainment of nurses, but also developing massive open access online courses and mutual learning cycles on digital use and artificial intelligence. And then finally, I'll mention the European Health Data Space, which of course is a very important initiative when we think about data and digital health. So there are several initiatives there, such as XIA or the EU Academy, that are supporting skills for real-world application of the EHDS and supporting health data access body.
Okay.
And then I'll end, sorry, one more thing. I'll end by saying that I think indeed attitudes are important, but when I speak to the health care workforce, what I hear is they're overburdened. They're working really hard, so they don't always have time for training. And so I think what our role is to make sure that we provide these trainings, but we also need to make sure they have the essentials. And what I hear over and over, which is the case in many sectors, time and money. So the final thing that we're doing at the Commission is providing country-specific reports, supports. So through the European semester, technical assistance with the technical support instruments, and funding. Funding through the recovery and resilience plans. These are plans that countries have made up when we started the Recovery and Resilience Facility. And in these plans, there are specific funds that countries are using to also make sure there are funds and time available to strengthen skills. Thank you.
Thanks a lot, Petronille. I think it became quite clear that you think, number one, the digital skills and the digital skills agenda need to be already kind of included in the planning and forecasting. Unfortunately, in many countries, it's not really very solid systems we have at the moment. And also what we will pick up in the second round also is that continuous professional development is absolutely key in this, and that member states actually can already use a lot of support tools coming from different programs and budget. Thank you so much for this. We have a quick second round, and I would like to start this time with Marius. And you already mentioned a little bit, AI, but what we really would like to understand is, what do artificial intelligence tools really entail, and are we ready for it? And is the healthcare workforce ready for it? And if we say, are we ready for it? I mean, Petronille, for example, said it's not only the health sector; it's all sectors. It's not specific to the health sector that we have digital skill gaps. So please, Marius.
Yeah. So I'll start with my answer. To your question, are we ready for it? My short answer is not yet, and certainly not uniformly. And what I mean by that, there are a couple of things that we need to take into account when we're discussing, for instance, about AI tools, we need to be aware of the fact that this is not a single technology. And it's like the classical story with the elephant. Depending on who you talk to about artificial intelligence, they might imagine a different thing, which is based by their perceptions, their experience, or their interaction with these tools. And so this is the thing that we need to first take into account, the fact that it can range from risk stratification algorithms, workflow automation, population health analytics, but even maybe more important than that, we need to be aware that the adoption of digital health technologies and AI tools does not only change how work is, not only by who the work is being performed, but how work is being performed. So in that regard, we were looking at the evidence, and we see that there are studies which are done by you at the Observatory, also WHO, OECD, and we're seeing that there are areas where these gaps are more pronounced, and some of them were mentioned here, like public health, social care, community services, and administrative roles. And so to sum up, I believe that one thing that we also need to take into account is that workforce readiness cannot come before organizational readiness. And so this is something that we need to invest in. And so linking to my first intervention, I believe that AI development and deployment must be value-driven and not profit-driven or interest-driven, and from that stems the need to have a clear ethical and public health-oriented framework in the work that we're doing.
Thank you so much, Marius. But the picture which is emerging is, oh my God, there is not a quick fix, you know, because we need to do so many things in parallel. We need to think about the planning and the forecasting. We need to think about organizational development. We need to think about our values. We don't have actually, in many places, the policies we would really need to support this.
Indeed, it might be overwhelming, Matthias, and let me add some more complexity about that. We are here at the European Public Health Conference, and maybe we're discussing more about what our European countries are doing and the challenges and the opportunities, but let's not forget that things, I don't know, let's say in Romania might not be the same as in Malawi, or in Sweden not be the same as in South Africa. So that only adds to the complexity, but I believe what we can do first and foremost, as I was mentioning in my initial intervention, before asking the big questions, let's ask the small questions, and let's take it piece by piece, because indeed it can be overwhelming, but it is places like this where we at least need to start acknowledging that.
So quite clearly, a lot needs to be done. So Gemma, can you fill us in what countries are actually doing at the moment?
So in terms of developing digital skills?
Yeah.
Okay, well, I mean, it is very variable. It's very variable. Some countries are much further ahead than others in this area. So I'd say one of the big challenges is actually in many countries, digital skills, even at the undergraduate level for basic training, isn't actually mandatory. So in the brief we did a literature review, we found it wasn't mandatory. It was often seen as sort of an optional extra. And I think, so obviously curricula needs to be reformed. I think to some extent there's a sort of this idea that young people are digital natives, so they know this and it's all intuitive, but actually they don't. So there needs to be sort of, digital competencies need to be mandated into curricula. Some countries are much further ahead than others. So we've seen, France, for example, are quite a leader in this area. So they've developed a digital health strategy. One of the core pillars is developing digital health skills. Connected to the strategy, they've actually mandated digital skills learning at the undergraduate level and continuing within CPD training as well. They've put funding towards it. So they've costed it, they've put funding towards this training. And they've done it for the wider healthcare workforce as well. It's not just focused on doctors and nurses, it's for social workers, for other professions as well. So there are countries which are leaders in this area and which are making great strides. In the UK, they've created a digital health academy where you can do master's levels programs. So they focus on the advanced skills. They have a digital leadership training course for managers or clinicians that want to be a leader in this area as well. So there are things that are happening, but in many countries it's limited. This is where sort of projects like Be Well step in with having courses in the national languages. So we found one of the when doing the policy brief, one of the big barriers to the training was most of the courses were in English, especially for CPD, and lots of healthcare professionals just can't access them. So making sure the training courses are available in the national languages, making sure healthcare workers know that they're out there, that they're available, that there's an easy way for them to access them and find them, that they're free of charge.
Thank you so much, Gemma. But, you know, that sounds really quite difficult. I mean, Marius earlier said he was sensing some aversion to change when it comes to digital. And you were telling us now that many people don't take it actually serious. They assume it is a given that the young people are digital natives and can do it instantly, but we hear there are so many different and complex skills actually, and even in the basic skills they sometimes feel. So it's a topic which is not so easy sometimes to bring to people. Is that your impression?
I think what we found when we did some focus group discussions involving healthcare professionals, and actually they found in many countries they wanted to learn, they wanted to develop digital skills, green skills, and there was a push from the bottom to have this put into place, but sometimes there was a gap between the national level listening and putting it into place. So I think there's a willingness, but as Marius has mentioned, some of the big barriers to healthcare workers upskilling, reskilling, they're organisational. Perhaps the culture's not there, the leadership's not there, the funding's not there. But some of the major issues are structural as well. So it's sort of, Petronille spoke about, and you've spoken about all the shortages in the healthcare workforce. The health workers are already overburdened. They work long hours. They see too many patients. They don't necessarily have the time or the motivation to undertake digital skills training because they simply just do not have the time. So that is something that really needs to be addressed before we can really think about effectively up and reskilling for the digital age.
I was actually in one of those focus group interviews, and we were discussing with the healthcare leadership of a country, you know, the skills and the training, and we were told we have everything. We have all gadgets, we have all infrastructure, but we are not using it appropriately. And the reason is the lack of training, but we don't have time to training because we have a health workforce crisis. All hands on deck. We have difficulties to staff the position, so we cannot think about systematic training at the moment. Thank you so much, Gemma, for giving us a little bit of an insight what's happening in countries. Petronille, a lot of is happening in the EU. We have lots of frameworks on digitals and new strategies. So please tell us a bit about the current developments.
I'll be very happy to do so. Just picking up on your point, indeed, we have a lot of challenges, and we do think artificial intelligence provide opportunities to support health professionals. They hopefully can, especially I think with administrative tools, can cut documentation time, giving hopefully clinicians more time for patient interaction where it's supposed to be. I think one of the panelists already mentioned that we see that AI is slowly starting to be used, but very much ad hoc. And so a couple weeks ago, we actually published a study that we did specifically looking at the deployment of AI in healthcare. And I think we see, we found many things that have already been discussed today. Our findings point towards the needs to bridge fragmentation, clarifying rules, improving data access and quality, and strengthening skills and capacity. What we're working on at the moment is to create a policy architecture. And with that architecture, we are focusing now more from design to deployment, so slowly supporting the use. So first we have the Apply AI strategy, which provides a unified European approach for deploying AI across sectors. This includes health and life sciences under coordination of the AI office. And it promotes also alignment between industry innovation, public health adoption, and ethical governance. Then the European Health Data Space, which I mentioned earlier, provides the data and interoperability backbone for lawful, secure, and high-quality secondary use of health data. So the essential infrastructure enabling AI training, validation, and monitoring of real clinical and research contexts.
Petronille, can I ask you, I mean, these are lots of frameworks, lots of activities, you know, but we also heard that many of the issues are very local. maybe even organizational. Some of them are national when it comes to health workforce planning and forecasting. So how do you make sure that all this is very well kind of adopted? What is the transmission belt for you, you know, with countries, with healthcare providers? How do you ensure, like, for example, the uptake of the European health data space and all these useful frameworks, you know? What is the Commission doing?
I'm not the expert on a European health data space, but I can tell you more about a specific project working on AI. So we just launched a project which is called Compass AI. And there what we're doing is we are bringing health professionals together with the developers, which we think is very important. And we're taking a multidisciplinary approach. So it works through 4 different activities. We are building an AI expert community, which will be basis for the European network of expertise on AI deployment in healthcare. And so they bring together the different stakeholders that work on AI across Europe to strengthen our approaches and our strategies. Then we also have good deployment practices on how to integrate AI in clinical workflows. So developing these step-by-step guidelines on how to further deploy AI in different settings, in different regions, in different member states. And it's focusing on 4 pilots, which I think is also interesting because you mentioned earlier this urban between rural different settings. And so exactly for these 4 different pilots, we're focusing on making sure that they're piloted both in the urban setting and the rural setting. And then finally, one other thing which I think is very interesting is this project, Compass AI, is creating an interactive dashboard. So there it's going to provide an overview of existing AI real-world applications across Europe, helping for us to get an overview. And I'll end by saying, I already described some of the work we're doing with regards to skills, but we are also navigating these new developments as things are fastly evolving. And we are putting a lot of attention on how to further enhance digital skills to support the health workforce for successful deployment of AI applications across
Thank you so much, Federica. And I heard that you were saying bringing together the users and the developers, actually. You know, it's a little bit like the bringing together stakeholders for the Be Well and for the development of these training materials. And Federica, maybe you talk a little bit more about the training you are facilitating, you have organized, yeah?
Yeah, I think that it fits very well into the discussion that we were having, and I want to reference what Marius mentioned. Are we ready for AI? And yeah, I agree. I think we are not yet, and certainly not with uniformity. And this is also what is shown in the preliminary results of the piloting phase of the digital skills training that we're doing with Be Well, because what we are seeing is, yet again, there is a lot of appetite for the basics. Of course, there is also interest for more advanced courses and more general courses, but also within the course on AI, it's all about understanding the basics of AI, like how AI works and how can it be used into practice. And another interesting result from the pilots that we see is how health professionals don't take these courses to become experts. They're taking them to increase their confidence, which I think it's quite interesting because probably it requires also a mind shift from our side, which is we're not training them to become coders, but they just want to be more confident in their daily work.
But that sounds very interesting, because we heard from Marius there might be aversion to change, and you help these people, you know, maybe overcoming a little bit of this aversion because you give them the confidence to use the tools?
Yeah, absolutely. And I think it's, I mean, Marius said it's not an easy fix. I don't think that there is ever an easy fix for anything. So I think it's this is a process. It's really change management, and change management takes time. It's full of obstacles. But we can just continue advancing, and we do this together. We also see from the pilots that although there are a lot of barriers in terms of time constraints, etc., that people do take these courses. So if we make them bite-sized, flexible in ways that people don't have to sacrifice a lot of time, then there is appetite for continuous professional development. I think that's quite an interesting point.
Thank you so much for proposing really concrete solutions. Thank you. Henrique, Thank you so much for joining us, and now we want to ask you in your capacity as ASPHER president, and training, continuous professional development, all this is very close to your heart, and you wanted to fill us in a little bit on the credentialing, isn't it?
Yeah, of course. To build a digitally competent, ethically grounded and resilient public health workforce, we really need modern, flexible curricula, updated codes of conduct, and schools that are able to provide all this, so that credentialing changes and evolves to recognize digital, data, artificial intelligence competencies, not as optional, but as core, as central elements of professional qualification. But allow me just to emphasize one aspect. All this cannot be transformed to a certain extent in possible inequality drivers. For instance, people working in rural or underserved areas might not be able to get the needed skills, so that they might be left behind. But the other way around also, an overemphasis on high-tech skills might marginalize the experienced people that practitioners that don't have this digital native approach. But anyhow, we think that what we need is a framework, a EU-wide framework to credentialize the profession. So all these things are recognized, and once again, people, employers, policymakers can trust the public health workforce.
Excellent. Thank you so much, Henrique. And we have just time for a very quick third round. Just take away messages, 10 seconds. Can we start with you, Petronille? I mean, you heard what Henrique was saying. He was actually asking for a qualification framework, that includes digital skills. Please.
Thank you. Strengthening digital skills is a must. We're facing increasing healthcare needs and health workforce shortages, so we will need to use digital tools for the challenges ahead of us.
Thanks a lot. Marius, please.
I would just leave by saying that this task at hand is not simply technological. It is equally about stewardship, about workforce development, and about safeguarding the core values of health systems. And so we need coherent governance, we need investment in order to leave the workforce empowered and not overwhelmed by technology.
So technical innovation also requires organizational and social innovation. Thank you so much. Henrique.
Well, to continue this discussion, I think it's very important. I just want to invite you the 15th to the 18th of July next year to come to Milan for the Congress on Education and Training Public Health that ASPHER is organizing. That will be a wonderful setting to continue this discussion.
Federica, please.
For me, the takeaway is about change management, is about leadership. I think that for the challenge ahead, we need strong leadership, but especially a leadership that is open to really openly listening to others, and is a leadership that is open to co-creation with others. In this way, we can really go ahead together.
Final comment from your side, Gemma.
Yes, so something I've already mentioned, but I think it's a key message aimed at policymakers, which is digital up and reskilling. It needs to happen, but it can't happen unless we address some of the major structural barriers and challenges facing the health and care workforce. So we need to improve health workforce planning and forecasting. We need to invest smartly. We need to invest in skill mix, optimizing the health workforce to make sure health and care workers have the time to develop these skills.
Thank you so much, Gemma. And I hope that this plenary has made actually clear that digital skills is a non-trivial issue and an issue which needs to be resolved in countries, because it is so essential if we want to raise the performance of our health systems and also address the health workforce crisis, because more and more recruitment for many countries will not be an option. We need more efficiency, and we hope that the use of digital and AI will raise the efficiency and mediate a little bit the health workforce crisis. Thank you so much. A big show of hands for this wonderful plenary, and we wish you a wonderful day.